Hi everyone, welcome back to my channel. In this video, I'm going to be sharing how to cope with the many side effects that you get from fertility medication. Of course, the side effects vary from person to person, but these are the side effects that I experienced going through my journey. So the first side effect that was really bothersome to me was weight gain. So I shared in previous videos I wasn't able to work out throughout the duration of me taking my fertility medication. And so there was really nothing that I could do to really counteract the weight gain. I already eat very healthy. And so dieting is not something that you should do when you are undergoing fertility treatment. It's important to eat healthy, but you shouldn't be dieting. You shouldn't be cutting out food groups. This is not the time to do that with yourself. So it was frustrating that I watched my body change and there wasn't anything I could do about it, but I knew that it was temporary discomfort. And so you kind of just have to push through. So I encourage you to eat as best as you can without compromising your meals. I was extremely tired throughout this entire process. And so that was a big adjustment. This tiredness is not something I normally experience, but things that helped me were taking like a midday nap, even if it was just like a very short one. Closing my eyes for just a couple minutes was really helpful. I also tried to go to bed a little bit earlier at night if I wasn't able to get a nap in. So I encourage you to do one or both of those things if you do experience tiredness. I also experienced quite a bit of headaches almost all the time. And so, unfortunately, I became pretty used to the headaches. For the ones that were just really taxing on me, I did take medication for that. I did take some Tylenol that is safe to take when you do have headaches with fertility medications. A lot of other medicines are not safe. So make sure you check with your doctor. But Tylenol was the go ahead for me. That was completely safe, but I only took it when I absolutely felt like I needed to. I didn't want to solely rely on that because I know that that could be pretty easy to do, especially with the frequency of your headaches. I also experienced some nausea and an upset stomach. And so when that happens, it's really important to just kind of step outside, get some fresh air, focus on your breathing, and it's super important to stay hydrated. If you are not hydrated, then this might exacerbate your symptoms, and so you really want to make sure that your body has what it needs. But of course, if you do have an upset stomach, then you need to do something about it and pause. I also experienced bloating, which nobody enjoys that feeling. And so this kind of went hand in hand with the weight gain that I had shared earlier before, and how frustrating that was for me. My clothes were fitting me differently. The bloating really kind of just made my pants feel differently. And so when you're going through fertility treatment, you're not in a place where you're going to necessarily wear maternity clothes because your body is not in that state yet. And maternity clothes would probably be far too big for you in the moment. You don't have like this big bump yet. But I mean, your pants are not going to feel the same way. So, I mean, sure, you could unbutton them, but who wants to just sit with like unbuttoned pants, right? That's kind of uncomfortable, at least for me. And so I have a variety of like different workout pants and yoga pants and whatnot, but my favorite pair of pants, the main ones that kind of stood out to me, I wanted to share with you guys because I actually wore this pair of pants my entire pregnancy when I was pregnant with Jeremy. And I didn't need to change the size that I wore. They are from Lululemon. They are the Align pants. And so I will show you how much they stretch. I'm not kidding. They are very stretchy. They do not like, they don't suck you in when you're wearing them to the point where you feel like you're going to like overflow. But because they're so stretchy, they make a really great choice for the days that you're feeling bloated, but then also know that you could still wear them when you're pregnant. I did wear them all the way through my entire pregnancy. So I think, yes, while they're expensive, they're a really great investment because unlike maternity clothes, those are temporary. I wear them now. I'm not pregnant, and I will continue to wear them, when my journey continues. So these are really great for me, and I never had to kind of like feel badly about myself because I didn't have to unbutton any pants. I could just wear these, feel comfortable, and that helped me a lot. So I definitely recommend trying those out. Um, the next side effect is pretty uncomfortable, but I wanted to share with you because it was a real thing. Constipation often does go hand in hand with taking fertility medications. And so, what can you do about it? You could take a light laxative like Miralax. Again, you don't want to get used to taking this, but once in a while, when your body needs it, you could certainly introduce that into your diet. Again, don't get used to using it, but it's okay on occasion. Some other side effects that I experienced were cramping, like abdominal cramping, and bone and joint pain. And this was really strange for me. Um, I experienced the bone and joint pain in my feet. And so it hurt when I walked. The the bones in my toes just they ached a lot and they were really sore. So I didn't want to be on my feet. I tried to kind of elevate my feet as much as possible, but I used a heating pad. So, like for cramping, I mean, you can certainly put a heating pad on your stomach. Since I had bone and joint pain in my feet, what I would do is I would take my heating pad and I would like truly wrap my feet inside of the heating pad, or I would put the heating pad on top of it or just like below my feet so that I could still get that sense of relief. That was really helpful for me. A great investment if you are undergoing fertility treatment to find a good heating pad. I will go ahead and post how you can find the one that I use. I'll put that in the description box, so I'll post all these things there as well. But definitely make sure that you have one with multiple settings is really great. Mine has many different features, so I really like that. Some other uncomfortable side effects that I encountered were like breast pain and tenderness. And there's really nothing that you could do about this. You could try to put a heating pad on temporarily, like on a low setting. But I just tried to wear some like loose sports bras that seemed to be helpful for me, in addition to just overall loose clothing. I did not want to wear tight clothing throughout this entire process. Your body's changing. You just don't feel like you want to wear something that's tight. That's just me. I also had a lot of night sweats. I still do, and so I mean it's disgusting in my opinion, but there's nothing you can do about it. I know that it's because of my medication, and so while you can't control what's going to happen throughout the night, I mean you could certainly control the frequency of when you wash your sheets. I recommend changing your pajamas or whatever you wear at night on a daily basis. I wouldn't rewear them just because if you do have night sweats, you're not going to want to put those clothes like back on your body by any means. I also had a lot of mood swings, and so I think that it's important to really encourage others around you to just have a lot of patience with you during this time, during your time like undergoing fertility treatment, and to be really forgiving and not to take anything too personally. And so for me, I was pretty good about recognizing after a situation had happened that I had overreacted and followed through by just apologizing to whoever I was overreacting towards. And so make sure that if you have that awareness and you recognize that you have overreacted, that you just try to apologize to those around you because you know that they love and support you. But again, this is something that is hard to control, but it's a real thing because the medications that you're taking, they are messing with your hormones. So your levels will go up and they will go down, and you just kind of have to do what you've got to do and be patient. And lastly, I also had a lot of injection site discomfort. So, with fertility medication, there are a lot of different types of medications that you could take, a lot of different um, types of shots that you could take. The shot that I'm currently taking right now is progesterone in oil. And so, prior to taking this, I need to ice the site. And so this particular shot goes in my butt and I alternate cheeks every day. And so you have to ice before and then you You have to have another person do the shot. At least for me, I feel like it would be very challenging to put in the right location and do it the correct way. So you might need help with some injections. And then afterwards, I apply heat. So I use my very same heating pad, but this is the shot that I'm currently using, and it's painful. This entire needle goes in, so it's an intramuscular shot. So since it's into the muscle, my butt muscles are very sore, so it is painful to sit. Again, I utilize my heating pad many times a day. It's like my new best friend. So make sure that you have one. While all these things that I've shared with you, I think are really helpful, they're not going to just magically take these side effects away, unfortunately. There's really nothing that I have found that can completely take it away, but these things do help. So I want you to know that there is a way for you to have some relief. And if you have other suggestions, please go ahead and post a comment below. Give this video a thumbs up if you thought it was helpful and informative. And don't forget to subscribe so you can be informed when I post all of my new content. Thanks for watching.